Hi, my name is Chista Kajiji Mwenda, a young leader in Diabetes, International Diabetes Federation, 2025-2027, Kenya. Also, the founder DDoC Africa. This is an organization for young people living with diabetes in institutions and also underprivileged areas. I am also a DDoC voice. These are global advocates for diabetes. Living in with the mantra of nothing for us without us, that is inclusivity for lived experiences in matters policy and all the decisions around the type 1 decisions. Being part of this national Kenya National Conference for non-communicable diseases is quite a good thing, which included all stakeholders, including people with lived experiences. And going forward, this should not only happen in conferences, but should go behold the conference rooms and go to the parliament, go to the hospitals, go to the society, go to churches, go to our communities, so that we include these people with lived experiences in decision making, which not only includes the policies but only actual things that happen in our day-to-day lives. I will also call upon the government, which was the main stakeholder for this institution, and commend them for the great work they did, bringing up this first ever non-communicable disease in the country conference, and also ask them to make sure that the implementation of all the discussions that went on are implemented and also evaluated to see the impacts to the lived experiences for the policymakers and all other ministries that they were represented, including the non-governmental foundations like YDF and NCDC and others. We need inclusivity of the grassroots initiative, so that because they're the ones that's in touch with the community and they experience the first-hand challenges, to be included in this kind of policy decisions. Because now, if we don't include especially the lived experience, then policy making, health policy making becomes a theater whereby it is just acting and drama. So we need the bigger part of it to be to include the lived experiences and these other initiatives and organizations for a good, patient-centric kind of approach in terms of challenges and impacts. And also the government be willing to open their arms to listen, and come with solutions that are sustainable for these people. So it was a great conference, and I believe these discussions are going to be implemented, and they are going to bring a lasting impact towards the campaign or this fight again on prevention and control of NCDs. Thank you.